Doctors on Reddit, what is the 1 in a million chance of this happening to your patient? When I inserted the catheter, I had explosive diarrhea all over my scrub. When I inserted the catheter, the feces came out. I think that's right. If you push on one side, poop comes out the other. Either that or I stuck a tube up his ass and scared the crap out of him. I was a trauma intern. A young woman was in a car accident. I don't remember the details, but she was in a car accident and had a thoracotomy. Back then, the odds of dying were astronomical. The very end. Turns out the accident was so serious that it punctured her heart. A fourth-year resident realized this immediately and stuck his finger in there to literally plug the hole. He laid her on her back with his finger in her heart and she was immediately wheeled into the operating room. He literally did preparatory exercises with her until one of the surgeons showed up to plug the hole. He then plugged the hole with scrubs. She was discharged home a week later. It was the coolest thing I've ever seen. She should have died, but thanks to him she is walking around and doesn't know how lucky she is. When I interned at a government hospital in India, there was a woman who was in labor for the 11th time. She had not had a normal menstrual cycle since the birth of her first child, alternating between pregnancy and lactational amenorrhea. Much farther down the list was a 16-year-old girl delivered, practically decapitated after a night's sleep. Her atlanto and shaft were somehow separated. This was supposed to hold the head in place and rotate it around the neck. If the head didn't hold up and fell sideways, an artery could be severed. All the doctors present were amazed. I couldn't find anything more about this case on Google. They weren't doctors, they weren't my family, but they were patients. My grandpa Fu, long story with nicknames, had a burst appendix when I was about 6 years old. He was hiking all day with an appendix, got mad at the gym that he couldn't drink another beer without pain, and my grandmother had to take him to the hospital. It turned out that he had pretty serious colon cancer, and up until that point it was the growth of the cancerous tumor that was practically covering, or rather holding together, his ruptured appendix. He had been tested several times for colorectal cancer, and they had all been negative. Had the appendix not ruptured, the cancer would probably have gone undetected until the very last stage. He survived the surgery and over the next 2 years was free of colon cancer. Next year, I'll have my first legal beer with him. Heart transplant nurse. There is only one patient in the world to whom this has happened. In the 1990s, he underwent a xenotropic heart transplant in which a donor heart was transplanted in place of his heart. That heart failed, and he came to us. He was a young man, he had a child, and we did everything we could to help him. We put him on ECMO, which is essentially an artificial heart-lung machine. There is no definitive strategy because most of these patients never get to that point. Nevertheless, the surgeon brainstormed and decided to implant a fully artificial heart by closing the donor heart from the 90s and scarring the lungs to keep it in his chest. He recovered from this surgery and eventually underwent a second heart transplant along with a kidney. This means that the man now has 2 donor hearts in his chest, one of which is not functioning. I don't remember everything, but I was told I had an unusual reaction. It started with a standard allergic reaction to antibiotics, hives, swelling of the tongue and throat, and difficulty breathing. I panicked and went to the hospital. When I arrived at the hospital, I was given a shot. I remember it was probably epinephrine or a steroid to stop the reaction. I have a tolerance for pain and can give good shots. I started swearing, I started getting blue streaks. I felt like the nurse broke the needle in my butt while giving me the shot. It was very painful and it felt like someone was increasing the volume of the pain. The intensity of the pain increased and intensified every time I felt like it was getting out of control. I began to feel like someone had inserted a red-hot pebble into my ass and was trying to burn it out. I'm not one to exaggerate, but instinctively I jumped off the table to escape the pain. I screamed in pain and began a ridiculous stop the pain dance, shuffling from foot to foot. A frightened nurse went to call the doctor, and it seemed like the entire night shift of doctors entered my room. Because of the pain, I don't remember exactly what happened next, but one of the doctors eventually told me that it was an unusual reaction to the injection. In fact, the doctors had only read about this symptom in books, and most of them had never seen it before. I think they told me that if I didn't want opioids, painkillers wouldn't help much. I think I was more afraid of the opioids than the pain, so I refused them. The pain continued for 2 weeks at different levels. But that pain tempts me to die of anaphylaxis. Dog, I was told you were having an allergic reaction, so I gave you an injection to relieve the allergic reaction. The nurse, a veteran former Army medic, and I were caring for a patient we found lying outside his home. According to the paramedic, he had collapsed outside his home with his face in a muddy slurry. Paramedics intubated him at the scene, and when he was brought in, found he had signs and symptoms of intracranial hypertension. A team of neurosurgeons came down from there and walked me to the CT scanner, looked at the scans, and sent me back to prepare the recovery room for an emergency ventriculostomy. Fortunately, it was a weekday and he was the only emergency patient. It was the beginning of flu season in late evening, so the room was empty for a while. Everything was ready and the support staff entered the room. While the neurosurgeon cleaned up and the anesthesiologist prepared, the procedure was textbook, but his ICP could not be controlled. The neurosurgeon was strict about minimizing irritation and avoiding hyperacidity, including using only a special Jankower oral suction device around the ET tube in preparing the patient for transport to the ICU. We attempted to clean the patient up a bit and remove the aforementioned sticky mass from the airway. The patient was then attempted to be transported to the ICU. The suction cup suddenly stopped working, and when I looked at the end of it, I saw a couple of maggots stuck in it. I yelled to get the anesthesiologist, but the neurosurgeon had already gone to the ICU dictation room to review the patient with me. He took a Jankower machine and a cotton wound probe and found a tunnel-shaped wound on the patient's upper jaw. A neurosurgeon was called, who went for an MRI, an ENT and plastic surgeon joined him, and the patient was taken to the operating room. A few days later, the ICU nurse came back on shift and said to me, I'm sorry. I've seen war wounds. I've been in all the ridiculous holes in the world. But I've never vomited on a patient. I say this to explain the context of my next statement. This patient with maggots in his mouth was producing flies and more maggots from another tunnel-shaped wound that could not be fully visualized on MRI. The wound reached the brain and one of the sinuses was also infested. I have never seen anything so ridiculous. I think the story was fairly well known at the time, at least in Australia. I grew up in a small country town about 2 hours' drive from the nearest major hospital in Melbourne. My mom worked as a nurse in this small rural hospital. This was probably about 20 years ago, so details are a bit sketchy. A boy was skateboarding or bicycling and hit his head. He was fine at first, but then he passed out and ended up in the emergency room. There were 3 beds in a room the size of my living room and 1 doctor on duty. The doctor realized there was a hemorrhage in his brain and decided that if he didn't relieve the pressure, the baby would die. The problem was that he was not a neurosurgeon and had never performed brain surgery. Nor was the hospital equipped to perform such operations. The doctor called the neurosurgeon in Melbourne and told him over the loudspeaker that they would have to drill a hole in the skull to relieve the pressure. They knew they would have to drill a hole in the skull to relieve the pressure. He had to drill the hole in the exact spot, and if he overdid it, the baby would die. As it was, he was successful. When the baby's condition stabilized, he was flown by helicopter to Melbourne. I don't know what happened next, but as far as I know he survived without any long-term complications. TLDR, an unqualified doctor used a metal drill to relieve pressure on the baby's brain. The child survived. My patient had recurrent episodes of confusion, speech and balance disorders for many years. A complete examination, imaging, tests and examinations failed to make a diagnosis. A specialist at a tertiary center finally diagnosed W epileptic seizures, but anti-epileptic drugs did not help. His symptoms were worsening. His wife rushed him to the emergency room to support him during the sudden modulation. This man doesn't drink at all. No, he really doesn't drink, but to my surprise, his blood alcohol level was ridiculously high. I diagnosed him with autobrewery syndrome and put him on a carbohydrate-free diet. When he ate fruit, bread, and carbs, he predictably passed out, although I monitored him closely to make sure he wasn't drinking. Does he hide his alcohol use? No, because if he were a person with such alcohol use, he would have relapsed. Instead, he and his wife are some of the happiest people imaginable. I'm not here to share a one-in-a-million medical case study, but to thank Reddit and its community for creating this issue. I'm a medical doctor, and most of the cases and experiences here are really enlightening, so thanks to Reddit and the doctors on Reddit for making this happen. I got a series of 5,280. The normal value is 8,100. The pancreas was examined surgically and was found to be completely normal. The doctor didn't explain anything about it. I am not a doctor, but my best friend is a medical student. He saw a patient with congenital insensitivity to pain with anhidrosis, which is apparently an extremely rare condition, 1 in a million. The likelihood of this happening is 1 in a million, he says. They don't feel pain and can't sweat, so they may injure themselves without knowing it, or their body overheats because they can't sweat while in a warm room. They need to be in a cold room with no sharp corners. The particular case my friend observed involved a 3-year-old girl. Apparently, her brother also suffered from this disease and died at the age of 4. They die very early because of this disease. It's sad. I don't know if anyone I know can sweat, but my friend's boyfriend feels no pain. He's in his early 20s. I'm not a doctor, I'm a patient. I have non-Hodgkin's lymphoma and my only symptom was in the middle of my biceps. To start with, I had never considered that the biceps brachii was a solitary tumor, even aside from the fact that the NHL affects 23-year-olds. My oncologist has been practicing for over 30 years and has never seen non-Hodgkin's lymphoma appear in the biceps before me. So the likelihood of a 23-year-old having non-Hodgkin's lymphoma arising in something other than a lymph node is ridiculously high. Rare. I'm a former firefighter paramedic. I was called in the middle of the night with chest pains. When I arrived on scene, I found a man in his early 20s with signs and symptoms of a heart attack. It is rare for a young man to have a heart attack in this neighborhood. We picked him up and headed to the hospital, located 45 minutes away. On the way, he became silent, looked us straight in the eye and said. His eyes became slurred and he collapsed on the stretcher. We put him on the stretcher, checked his pulse and monitors, but there was no pulse. When we started CPR, he opened his eyes and looked around the ambulance. The compressions were stopped, defibrillation was performed for 30 minutes, medications were administered and compressions were resumed. This continued until he was taken to the hospital. As I was writing the report, a doctor came up to me and said, "You have been transferred to the cardiology department and you have regained normal sinus rhythm." The look on our faces must have said something to him. He lay there for a long time, but he didn't die. Well done, guys. As an 18-year-old paramedic, I was totally amazed by this. He had an aortic dissection, but the hole was small enough to allow blood to flow when his chest was compressed. He underwent surgery and made a full recovery. I'm not a doctor, but when I delivered my son via emergency C-section at 31 weeks, the doctor later told me that he had no pulse when he was born. They immediately tried to resuscitate him. I didn't realize what was happening as there were about 8 doctors around my son, but after about 5 minutes all hope was lost and after another 6 minutes he took his first breath. The doctors said they had never seen a child come back to life so quickly after lying down for so long. My son is now 6 years old and is perfectly healthy, with no long-term complications. He was in the NICU for 45 days before we brought him home. I can't imagine my life without him. I'm not a doctor, but I was a paramedic. A middle-aged man reclined in a large chair and went into cardiac arrest. His wife was understandably distraught. There was a very incompetent paramedic assistant on my shift and I was afraid to rely on him. I asked him to help me lower the conductor to the floor to begin CPR. When he did, he lowered the patient's upper body and I held his legs while his back hit the stone floor with a loud thud. At this point his wife began to scream and he began to lose his mind. I noticed he was breathing unnaturally. I thought he was just breathing irregularly, but he definitely had a pulse. When I reviewed the case later, many people said, he probably just needed to clear his airway, or he wouldn't have been arrested at all. But I tested him myself, I swear. I repositioned the airway before we trotted off, and my wife confirmed that he was in a panic state with no pulse for at least 5 minutes before we trotted off. My incompetent partner had essentially restarted the heart by lowering the patient's torso and giving him a reverse atrial push. I still had to record his actions, but I also believe he inadvertently saved the patient's life. I'm not a doctor, but my twin was already sick, and after getting her teeth cleaned at the dentist, she became septic. There were literally no signs until one night a week later when he started vomiting and passed out. I went to the hospital, got antibiotics and came back healthy. 3 days later I got a call from the hospital on my way home. He had sepsis, but there were no signs of it. I was told that if I hadn't gone to the hospital that night, I probably would have died. I am not a doctor, but my youngest son was tested for a respiratory disease called theomalacia. He has an incessant cough and sometimes chokes on food. During the scan, they noticed a dilated blood vessel in his neck and traced it to his brain, where they found a large AVM, a blood pocket formed by veins and arteries growing into each other. It turned out to be caused by a rare genetic condition called ROSA1. He also has red patches all over his body where capillaries are failing to do their job. The tips of his fingers look like they've been pinched by a door, that's how red they are. He is one of 10 children being treated at a very good children's hospital in London. I was told that if it wasn't for Teo's initial checkup in Malaysia, the tumor might not have been discovered before it ruptured. Even now my blood boils at the mere memory of it. He has had 2 operations to remove the AVM and will need to have scans every 5 years. Another bonus was that he was less than 4 years old when this surgery was required. This happened to a friend of mine who works as a cardiologist. As is often the case in our area, they exercise once a week in conjunction with their job. At most workplaces, they spend an hour each week indoors with their coworkers playing soccer or floorball. One day as they were leaving the training center after class, an elderly jogger walked past them and went into cardiac arrest and immediately fell unconscious. He is not currently in the hospital. Needless to say, he made a good recovery. I'm not a doctor, but my cat had an insulinoma, a tumor of the pancreas that overproduces insulin. There are only about 10 documented cases. My vet sent him to a cat specialist in a neighboring province who was a super top-notch specialist in this country. Surgery was performed to remove the tumor and, incredibly, he recovered and was not diabetic thereafter. He died about a year later from a brain tumor and bone cancer that appeared to have spread from the insulinoma, but his case was phenomenally rare. I invited veterinary specialists from all over the world to review his case. I specialize in treating transgender people. One transgender patient told me that he was experiencing cramps similar to female menstrual cramps every month, but he was cured when he underwent HRT. I didn't pay much attention to this. The patient eventually underwent sex reassignment surgery, and during the surgery, the surgeon discovered that he had an underdeveloped vagina and uterus in his pelvis, as well as small ovaries. The patient also had a penis and testicles. The patient's blood keratin was 46XXX and the uterine tissue keratin was 46XXX. The patient was a true chimera, a very rare case of male and female hermaphroditic twin fusion. I still find it hard to believe. Sometimes I wonder if this patient would have been able to father a child if her uterus and ovaries had functioned. I had a friend who was born sextuplet, declared male at birth, and only found out when she later transitioned to the female gender and began menstruating through her penis at puberty. After hearing this story, I will never complain about cramps again. This story will probably be buried, but it is such an interesting coincidence that I thought I'd share it. Although I am neither a doctor nor a patient, my father was a patient in this case. He had a tooth extracted, and while the wound was healing, an implant was placed. Months and 3 weeks later, shortly before the tooth was replaced, he developed a sinus infection that he suspects was caused by the wound in his mouth. Today he went to the dentist and had X-rays. The implant had somehow dislodged, burrowed into his jawbone and traveled into his sinuses, causing an infection. The dentist said there was a 1 in a million chance of this happening, and he is now on antibiotics. Interesting that this happened literally an hour or so ago, and suddenly this topic is on the front page. Life is funny. Anyway, he's supposed to have the implant removed on Monday. That's weird. My dad had the same thing happen to him. It doesn't happen very often. I'm a nurse. An elderly patient came in with heart failure and pneumonia. She was having trouble eating. She coughed no matter what I fed her, so I asked for a swallowing test to determine if she could eat and drink comfortably. It turned out that 3 months ago she had lost her lower partial dentures. They were removed and the radial appliance fit perfectly into her esophagus and has been there for the past 3 months. The family was thrilled. I don't think I should be answering this if I were the patient, but okay. I had a cut on my heel, pretty bad, but not bad enough to go to the doctor. After a week, the pain spread from my heel to my calf. When my mom finally looked, there was red swelling from the heel to the calf. I went to the doctor and was told it was an infection caused by someone on staff and it had spread to my kneecap. What saved me was that one of the attending doctors prescribed me a new antibiotic, the name of which I can't remember. He was worried that if the infection spread or proved resistant to the antibiotic, he would have to amputate the knee before it spread further. Thankfully, the infection receded and I am completely cured thanks to this doctor. The only symptom I still have is a chronic knee problem in my right knee, where the infection just destroyed the meniscus. You can still answer this question. Glad you are living with relatively few complications. I've written about this before, but it's relevant. My mom was a piano teacher, and she had a student who broke her hip in a full-speed collision with another girl at soccer. Anyway, she had a lot of trouble in the hospital. I remember watching an episode of House after the Super Bowl where he diagnosed a woman in Antarctica. Her fractured toe had been improperly fixed and the bone marrow had gotten mixed in with the blood. When I found out about it, I told my mom about it. When my mom told the girl's mom about it, the girl's mom told the doctor about it. Laughter, no way, the girl coded again, and the mother had the doctor check it out. Yeah, inappropriate environment. Thank you, House. Subscribe to our channel here. We post a new video every day. In the meantime, stop by to see a new video.